UW veterinarian Sandi Sawchuk is with us today.
We're taking your calls at 270-9933. Hello, Sandy.
Welcome back.
Oh, it's nice to be here again.
Let's talk about the big story right now, the dog flu. What's the latest?
Well, the latest that we have is that we really don't know what to tell you. And the reason is that, just to recap a little bit, there's this outbreak that has been going on in northern Illinois, Indiana, and we've had a case here in Wisconsin. And initially we thought it was the H3N8, the influenza virus that we've known about since 2004 and that we have a vaccine for. But as of Monday, we ended up finding, because of really good work on the part of the University of Wisconsin's laboratory, actually it's the state lab of veterinary lab, they did some really good work and found out that this is a totally different influenza virus. It's H3N2. Now, that one's been identified in China and Korea, and we don't know if that is the one that we now have in our country or whether this is a new one to our country. They have to do something called sequencing, and so we're now working with a lab in Ames, Iowa, and we should hopefully have that back soon. Now, our dilemma is that we have this vaccine that is for the other influenza, and we're still recommending that dogs, if you've got a high-risk dog around a lot of other dogs, you may want to consider vaccinating your dog, but we don't know how well it works. So it's a matter of being smart with your dog. Make sure that you perhaps if you've got dogs that that have not traveled out of the area that your dog's friends with, let them play with those dogs. Maybe not take your dog to the dog park, or if you do, put them on a leash. I think we've had one case here so far. We're just waiting to see where it goes because people travel, and we're going to probably start seeing other cases very soon.
And the vaccine you have now does not necessarily treat this other strain.
It may or may not. We'll find out. It may help. It may not. But the thing is, it doesn't hurt. So if you have the ability to get your dog in to be vaccinated, I'd say go for it.
Okay. Let's go to the phones. We'll start with, I don't have a name here. Anyway, Chad in Portage. Hi, what's your question?
Hi, yeah, I have a small dog, and every time that I leave, I put him in his kennel, I give him a little treat. But I don't care if I'm gone for 20 minutes or all day long, he will not eat that treat until I come home.
Yeah.
Why?
Well, my guess is that your dog probably has a very mild form of a behavior problem called separation anxiety. It's common for dogs that are very bonded with their owners to sometimes be upset when you leave. You may see things such as howling, digging, some dogs will urinate and defecate, try to escape. Others just become kind of shut down and anorectic. I used to have a basset hound that did exactly the same thing. You'd give them a cookie, it would just spit it out, and then as soon as I would walk in the door, he'd grab that cookie and eat in front of me, wagging his tail and all happy. So it's probably a very mild form of separation anxiety. And do you have to do anything about it? Probably not. But things that we usually do for separation anxiety is try to limit really emotional arrivals and departures. When we're getting ready to leave and we're feeling a little guilty on ourselves, that dog parent guilt, oh, I gotta go to work, the dog's probably feeling that, and then when you come home and you're like, yay, I'm finally home, you've just made the difference between you being gone and you being home so great. So try to make it very even keel.
Oh, it's good advice.
Yeah.
If you're on the line, stay on the line, and if you'd like to talk to Sandi, we have 2 lines open. We're going to take a quick break, and then we'll be right back with more calls.
UW veterinarian Sandi Sawchuk taking your pet questions, and we will continue now with Sam in Argyle. Hi, Sam.
Hi.
Hi, what's your question?
Hi, I've got 3 dogs, and they're in and out of the house quite a bit. I'm just wondering what's the best way to treat them for fleas.
Yeah, well, if you have an existing flea problem in your home, remember the fleas that you're finding on your pet came from eggs that were laid approximately 2 months ago from an adult flea. So when we have an existing flea problem, it can take up to 3 months of using control methods to be able to extinguish the immature stages that are in the environment. And so there's a number of really good, safe products that are on the market right now. Some of my favorites for controlling fleas and ticks, because we do live in Tick Central, is to use something called the Seresto collar. The Bayer company makes it. It lasts for 8 months. It's safe for use on dogs and cats, so you can have multiple species in the house. And it's very economical for the fact that it lasts for 8 months. The other product that I like are the oral products. There's one called NexGard and another one called Bravecto. One lasts for a month, one lasts for 3, and you don't have to put anything on their back, and so there's no chemicals to come in contact with. But for the most part, any of the drugs that have, or the spot-ons that have fipronil in it, which is like Frontline, those types of drugs, very, very safe. There's been like virtually no toxicity cases reported, unless you read Dr. Google, where there's a lot of stuff that is written on there, but very safe products to use. But I happen to like the collar or the oral better.
All right, great advice. Let's go to Carol in Sun Prairie. Hi, Carol. What's your question?
Hi, I was wondering if there was a rule of thumb as to how many different inoculations or vaccinations your dog or your pet could get in one visit to the vet.
Oh, what a great question. You know, it really depends on the size of your dog and the vaccines that they're getting. The smaller the dog and the more vaccines you give, the greater the chance of having some type of an adverse response to all those vaccines. So when, you know, we have a big dog, like a Labrador Retriever or something like that in, we can usually give all the core vaccines and even some of the non-core or the lifestyle-associated vaccines like the leptospirosis vaccine and the Lyme vaccine and now the new influenza vaccine. But if you've got a tiny dog, like a little miniature poodle or a chihuahua, we like to separate those vaccines out so that we're giving them at different times. Remember, anytime we vaccinate, we want to wait at least 2 weeks between vaccine episodes. You don't want to do it one day and then another day. Separate them out by about 2 weeks, and that really helps cut down on the side effects that you may see.
We're out of time. Thanks for everyone for calling in, and keep us updated on the flu situation.
We'll know more, hopefully, before the end of the week.
Okay. Thanks, Sandi.
Thanks,
You're
Sandi.
welcome.
Good to see you.
We'll be right back.